Someone asked, "Hi, my husband thinks that botoxing is unnatural. What's your view on this?"
I mean, I kind of support the husband a little bit. You notice that, okay, so look, every doctor has a different philosophy here. I'm not saying this is right. I'm just saying this is my philosophy. If I assess a patient and I feel that the patient needs, let's say, a filler treatment, I am more likely to push the filler treatment to the patient. I'm going to explain to the patient about, okay, look, the fillers will make you look better because of this. The fillers will affect your muscles, which will do this, and your fillers will affect your ligaments, restore support, which will do this. Why? Is because fillers have a long-term result. It doesn't just make you look better. There's a lot more than that. There's an anti-aging effect. So the earlier I do it for you, right, the earlier I can prevent your face from changing in a way that you do not want it to do in the longer term. But for Botox, there really isn't much of this, to be quite honest. What Botox does is that when the Botox is injected, the muscles are relaxed. The symptom that you don't like, whether it's a deep frown, very deep forehead lines, or many crow's feet, it improves. And 4 to 6 months later, when the Botox is gone, it kind of comes back. It kind of comes back. So some people also, but on the flip side, right, some people believe that, oh, if you keep injecting Botox for many years, and then you stop injecting, right, your face will collapse. It will be terrible. No, it does not. So Botox does not really have a long-term problem. It's basically a cosmetic, in my opinion. It relaxes the muscles in a way that makes your face softer in certain expressions. So basically, I almost never push Botox on my patients, right? Unless two things. I always say, let the patient ask me about it. Because if the patient comes in and says, look, my frown makes me look fierce, my subordinates are all scared of me, or like my crow's feet makes me look old. Every time I take photos, I don't want to smile for photos. I'm like, for photos, then that means that the lines, right? The lines are affecting the patient's life. It's affecting the way she does certain things, and she's obviously conscious of it. So using Botox, right, to take this symptom away, right, it's important to improve that quality of life for the patient. See, so that, when she takes photos, she doesn't have to be self-conscious about all are there lines, right? Should I smile in a certain way, or feel, maybe by the way, this is a true patient. The gist is she doesn't have to worry about looking fierce all the time, you see, because maybe she is fierce, but she thinks that everyone's scared of her because of this, right? So you take that away, right? She's not self-conscious of that thing. So I think Botox is unnatural in the sense that unlike certain treatments like fillers, you are not really reversing the process of aging, but rather you're hiding a symptom of aging. So if you want to see it as that, okay, I guess you can say it's unnatural. But the thing is that there are no long-term side effects, right? It's not to say that there are no risks. There are risks, but I think there's no long-term problem using Botox. Once the Botox is gone, the effects are gone, right? And it doesn't affect your health or your body. And I think that instead of perpetually being self-conscious about a certain expression, right, to just take that away and let you live your life normally, right? I think it's a very worthwhile thing to do,
Sounds good. Okay, great. Maybe one last question before we take a break, because we have reached around the midpoint of our webinar. One question that even I am very interested about knowing: can you take away eye bags?
Yeah. Okay. So eye bags, right? Once again, we have to understand what an eye bag is. I'm not gonna be like super technical about this. The gist is one common misconception, right, is that eye bags are caused because we don't have enough sleep. It's caused because we have water retention, or because eye bags is like a lump of fat, right? Or like there's too much fat in the area. So it's not. What the general problem with eye bags, right, is that the muscles and skin, right, that's holding that fat in is weak. So the eye bag is kind of like pushing out through that skin, that muscle. So the easiest way to make eye bags disappear, therefore, right, is to lie flat. you lie down, you're gonna see your eye bags go away, and then you sit up, you're gonna see your eye bags come out again because gravity pulls the eye bag through that weakness, you see. So then the solution to eye bags, right, it comes therefore in a like a in this one like a progress, right? So if the eye bags are not really bad, what you can do is that you can use fillers to strengthen the muscle, the eye muscle that holds the eye bag in. So fillers to the temples, fillers to the cheekbones, these can help strengthen the retaining ligaments that affect the eye bags, while fillers to the eye muscle itself can also help to reinforce that muscle, once again to hold the eye bag in. So you see this, once again, as we've been mentioning over the course of today, this will improve the appearance of the eye bags, but it will also slow the progress of the eye bags over the years. So it's really important to do it at the start, right? Okay, so now maybe you are 60 and you've never done anything like that before, and now the eye bags are completely beyond, beyond So at this point, right, the fat has gone through that weakness. It is no longer protruding out because of a weak spot. It's already through it. Similarly, as I mentioned, if you lie down, it won't go away. It's already all the way out already, right? Then the solution is no longer aesthetic. The solution is surgical. You have to see a plastic surgeon to get that fat removed and get that area reinforced.
Oh no, that sounds bad, because my mom personally, she was actually looking into maybe doing something done that is non-surgical for eye bags, but I guess it might actually be too late.
You try the lying down method.
The lying down method.
Lie
If
down,
it works,
if it works, you can reinforce it. If it does not work, it's surgery. I mean, it's not a perfect science, but it's a good way to have a gauge.
Yeah, I guess I'll do it tonight later. Okay, so what is a proven way of removing old pimple scars, pockmarks? I heard from a plastic surgeon the only reliable way involves some cutting and sewing.
I mean, yeah. If it's a huge scar, right, you can excise the scar, which is what the plastic surgeon is describing. But in terms of pockmarks, right, like deep pockmarks, the general way, sort of like the most traditional way, is subcision. Because what happens with a pockmark, right, is that basically you had a pimple, the pimple is repaired, and all the tissues, right, that repaired this sort of like hole in your face, right, that they contract and they pull your skin inwards, which forms a hole, right? So if you think of like skin, hole, healing tissue, and healing tissue contracting, you see this is why there's a pockmark, right? So the oldest way to deal with it is taking a needle and stabbing it. This is called subcision. When you stab this fibrous tissue, right, it weakens it, so it releases the skin. So then that pockmark gets shallower, right? Then as technology progressed, we start to have things like microneedling. So instead of like stabbing it, right, a set of needles comes in, it breaks it apart, and then usually it runs an RF pulse to further break this apart, and also at the same time regenerate collagen in the area. So that's microneedling. Ablative lasers, obviously, because this is the thing, right? But then the skin is on the surface. So ablative lasers, they go cut. Every session, they makes it shallower. And of course, you have things like strong acids. Strong acids will, basically it's called TCA cross. What it does is that you can actually directly drip it in here to destroy what's inside from the inside. And once again, okay, so all of these are aimed at damaging the scar tissue that's holding that pockmark down, so that it releases it and the skin comes up a bit more. So this is for pockmarks. For more like general like acne scars, not just ice pick scars, but acne scars as in general, resurfacing treatments are always good. And then as I mentioned, I find picosecond lasers, right, sort of like the most convenient way to treat this, because it's safe. I mean, it also has risk, but compared to like cutting the skin, stabbing the scar, pouring acid on it, right? Yeah, I'm just being dramatic. But compared to these things, right, it's safer. It's safer. The downtime is much more manageable. The pain is much more manageable. The risk actually is much more manageable. So I find that for acne scars in general, pico lasers effective. But for extremely deep scars, extensive rolling scars, you may want to use something that is stronger. One of those things I mentioned previously. So you want to or even surgical methods like the plastic surgeon mentioned. Yeah, but you have to first obviously discuss with your doctor about expectations, about downtime and risk.
Right. So I guess to answer, as in kind of to prevent all these very, very deep scars from forming initially, will be then good skincare and like maybe controlling the active acne from the start, right? Are there
Very true.
actually any ways that you can help with active acne in this sense?
Yes. So acne, right, is a cycle. And breaking the cycle is extremely important. So what's acne, right? Basically, it's a comedone, a whitehead, and then this whitehead gets infected by acne bacteria. It becomes a pimple, the red angry one, right? And then now this pimple, all the acne bacteria is growing in this pimple and festering in there. And then these bacteria will then go next door to infect other whiteheads to make more pimples. So then the cycle perpetuates itself, you see. So it's really, really important to cut that cycle of acne. You totally stop that cycle so it doesn't keep going on and on. And you see, acne will just go away, but what we don't want it to leave behind is things like marks, things like scars, and especially like we mentioned previously, things like terrible scars. So you want to cut this cycle really, really quick. So therefore, to cut the cycle, generally there are a few ways. You want to kill the bacteria. So antibiotics will kill the bacteria, whether it's oral, whether it's topical creams, whether it's lasers. Certain lasers will help to kill the bacteria. And then you want to get rid of the comedones, the oil, right? So getting rid of the oil, right, there are two ways. One is to reduce production of the oil, which would be lifestyle modifications, which would be certain medications. And then removing the oil faster would be certain types of skincare, face washes, things like hydrofacial, and certain lasers also to remove oil, debris, dead skin, comedones from the skin. So yeah, you want to be aggressive in controlling acne, right? But then you don't want to damage the skin together with damaging the acne. So the treatment of acne basically is aggressively get control, break the cycle of acne, but always remember that while you are killing the acne, right, you have to keep the skin healthy. You don't want to dry the skin out, make it sensitive, destroy everything just to destroy the acne.
Right. Okay, I think on the topic of lasers, someone asked if I have very dry skin, will using lasers make it worse? They're probably looking at maybe some laser treatment that they probably need, and then they have dry skin. Are these compatible then?
Yeah. So this is a common question. Basically, will lasers make my skin dry? The more common one is, will lasers make my skin thin? Will it make my skin become pale, right? The in general, very, very general, there are two kinds of lasers, right? Ablative, non-ablative. So ablative lasers are lasers that cut, right? CO2 lasers, erbium lasers, any laser that resurfaces, right? It's going to remove stuff from your skin and ask your skin to regenerate, right? So if you do too much of that laser, right, it can make your skin more dry, more sensitive. So as we mentioned just now, the importance is pre-treatment, post-treatment, and also obviously choosing that treatment wisely, right? Other lasers, right? Let's say for example, you're doing a laser for your freckles, it will not affect your skin condition. So it's not going to make the skin more dry, less dry. It just won't affect. It's not meant to. And then lastly, there are certain type of lasers, right, that promotes collagen formation in your skin. So when you thicken the collagen matrix in your skin, right, the skin holds more moisture. So these lasers will actually make your dry skin better.
Wow, okay. That sounds great. Okay, that's like a very big worry because usually you would think of like something like light hitting your skin and you think that it would dry it out even more, make it worse. But that's good to hear that something can actually stimulate collagen production, which is pretty rare if you want to rely on like topicals, that kind of thing. Okay, next question. Someone asked, What do you do when you suspect vascular occlusion after filler injections? That's quite a complicated question. So
It's
maybe
not complicated. Actually, it's a very good question. But usually I answer this question when I'm speaking to a doctor audience. I think for a lay person audience, right? The thing is this. Oh, I see. The question is, what do you do, not what do I do? Okay. Then it's a good question. Okay, so what vascular occlusion, right, usually happens, right, very, very soon after the infection. So it's not something that will happen 5 days later, 10 days later. It happens soon after. Soon after. So the most obvious sign, right, is pain. Is pain. Because if your blood vessel is blocked, something is dying, something is not getting oxygen and is dying, and it will be in a load of pain. So if you feel unnatural pain, right, especially when you're not getting injected in the area, right, you have to straight away sound it out to your doctor. Yeah. And then the other thing would be skin changes. So the skin turns white, it turns flushed, and after a long time, right, it turns dark. So it's pain and skin changes. You have to straight away sound it out to your doctor. Yeah. In terms of high risk areas, where we mentioned the frown area and the nose area, obviously it's the same thing. Pain, like out of control pain, skin changes, but there's also one more thing: blurring of vision. So if this extremely unfortunate thing has happened, you may notice blurring of vision, double vision, or actually pain or pressure in the eyes. So then obviously sound out to a doctor. So what we can do in terms of vascular occlusion in not related to blindness, the most straightforward solution is to dissolve the filler. So most HA fillers can be dissolved by this chemical called Hylase. And then there are certain products that cannot be dissolved. There will be things like autologous fat, means the fat that you take out from your own body, things like collagen stimulators, and things like permanent fillers. But I think by and large, generally, HA fillers are the most commonly used injectable now in the market. So they can be dissolved by Hylase. And if the skin is dead damaged, right, then the treatment would then be over time to repair that damaged skin. Usually, the recovery is complete. If we're suspecting blindness, then there is honestly no very, very good cure for blindness. We will recommend high doses of Hylase pulse into the back of the eye to try to get it into the blood vessels that's affected, and obviously Hylase to dissolve the original area of the filler injection. So that is also there are many ways to try to restore blood supply to the eye that the doctor will do, but the chance of recovery is pretty low should it happen. Yeah, but the chance of it happening is exceptionally low. So but we cannot forget that while it is so rare, right? If it happens to you, it's 100% you. It's not like 0.01% anymore. So before injecting any danger areas, you really have to understand that this is the risk that you're taking, and you have to understand that alternatives to treating the area, and perhaps you may want to consider an alternative that does not have this complication.
Understood. So just to clarify, HA fillers, you mean hyaluronic acid, right?
Correct.
Okay, so I believe there's another person asking about this, something similar. Hi, Profhilo and filler, what's the difference and which is better for concern on sagging chins, or Threadlift is the best?
Sagging chin? As in jowls, right?
Maybe it'll be the jowl area, Profhilo and filler. What's the difference? Which is better, or is Threadlift better?
Okay, so is this a safe environment for me to answer questions? Will there be a Profhilo representative in here who will hit me forever?
We will never know because it's an anonymous webinar where people have signed up for.
Okay, so I'm just gonna give like my most honest answer, but this is based on my experience. Okay, Profhilo is meant primarily for skin hydration. And I think it's a great option for skin hydration because it's only 5 injections on each side of the face or each side of the neck, which is much, much, much more bearable than other options that have been proven to work very well, right? So I think it's a good choice. Does it do a bit of lifting? It purports to do lifting, and a lot of people do promote that function of it lah. But if I was to be absolutely honest, if you have sagging marionette line, I mean, you have saggy jowls, you have marionette lines, you have a loss of the contour of your jawline, it's saggy, right? It's very unlikely that Profhilo will lift anything. I'll just be super honest and say this. Where does Profhilo shine, right, is in younger patients. They're not really saggy, they don't really have a problem, right? The Profhilo will give that nice little tightening, right? That is very, very nice aesthetically. So for very young patients, I think it does lift the face. And the other thing that Profhilo does really well, right, is lifting and tightening of the neck. Yeah. So once again, don't expect your necklace lines, those deep lines that run across the neck to disappear. They won't disappear. But the neck has this effect, which is very nice. And in the leg, okay, so there's many, many things you can do for the face, right? But in the lack of other really good options for the neck, I find Profhilo really convenient and effective in terms of tightening, lifting the neck. But when it comes back to actual sagginess, it's not going to lift it, right? So then your next question is fillers versus Threadlifts. Once again, this is my personal opinion. By and large, okay, there are Threadlifts deeper planes, especially if the threads are surgically inserted. By and large, Threadlifts are a skin tightening procedure for the more superficial plane, for the skin itself, right? So we're talking about sagginess just now, right? This sagginess is, once again, as with everything else in the face, due to loss of support, right? So I would never do Threadlift before fillers because the Threadlift has the most impressive wow factor. You're done the procedure, patient takes the mirror, and the patient is very happy. But the thing is, Newton says, right, every force has an equal and opposite force, right? The face already lacks support. I am tugging it up against gravity. What happens? It pulls back down. So your Threadlift results won't last. So it looks super nice at the start, right? And then it comes down. So how do you make your Threadlift results last, right? You have to first address the underlying cause of that sagginess. So usually for a facelift, if you're talking about saggy jowls, marionette lines, jawline, you want this, I always start with Altera. Altera and fillers is my standard so-called signature facelift. Why? Because Altera does a global skin tightening. It doesn't target a single vector, it treats everything. So it tightens the skin, it works on the SMARS, right, which is layer under the skin, to pull the skin up, sort of like a harness. And so what you get, right, is improvement in your nasal folds, your marionette lines, your jowls. You get a general upward tug that also supports the skin because of collagen formation over time. So I start with Altera. First, I make the face smaller. I make the weight that I need to carry less. Then I put the fillers in, right? Because the fillers are going to restore support to these ligaments. It's going to basically, it's going to reverse the changes due to age in terms of soft tissue support. So it's not going to make you go back to 16 years old, right? But it's not going to make you go back to the situation it was 3 to 4 years ago. It restores that support, right? So it holds everything up. So Altera has already tightened everything, made everything smaller, slimmer, lifted. The filler holds everything up and makes that result come out. So at this point, right, if you're happy and you do this treatment every single year, right, you will find that as you get older and older and older, your face looks younger and younger and younger. In a way that is natural. It's just because we're not putting any product where it wasn't before. We're not putting support where it wasn't before. This is the greatest pitfall of aesthetics, in my opinion. We are putting volume back where it was when you were younger. We're putting support back where it was when you were younger. So we're holding your face up against age. That's the thing. But let's say you do it already, you see, okay, it's improved, I'm really happy. I look 3-5 years younger, but I want to look like that. You know, that extra, that's when the Threadlift comes in. When you want that perfect result. You know, Altera fillers, I would say the bulk of the work, right, is anti-aging, and then there's the aesthetic improvement. right? But Threadlifts, right, without putting the Altera first, without the fillers first, Threadlift will be impressive, and then it won't last. But then if you have already formed a good foundation with your Altera and the fillers, and then you do the Threadlift, then you will find that you're going to get that long-term improvement, but also that wow effect that you like. So for me, Threadlift is the icing on the cake, you know, the thing that, the wow factor, but it cannot be done usually, unless you're very young. Obviously, if you're very young, then it can be done on its own. But usually I will do it on its own.
Sounds great. Actually, you gave me a new perspective on what is actually useful, and you didn't even give like, maybe you didn't answer the question specifically, more like, oh, fillers, but you actually gave a whole step-by-step process of what actually works best together to actually create a better result. Yeah. Okay, one question will be, do collagen blend, collagen peptides, glycine, L-lysine, L-proline, vitamin C, vitamin E supplements, do they do anything for our face and facial aging?
Yeah, well, okay, simple answer. So this is a quick one. Basically, when you're taking collagen drinks, you're supplementing your daily dietary intake. You're already eating collagen when you eat your fish, your eggs, your beauty pot. You're already eating collagen. Okay, so supplements are generally like just an add-on to it. Usually, these collagen drinks are not going to go to your face because your face is generally not in a state of repair. So I would say not really, but if, for example, you just did a Pico laser, you just did Altera, you just did an ablative laser, your face is in a situation of repair, and then you take all these collagen supplements, right? Obviously, you will go to the face that's asking, the part of your body that's asking for it, in this case, your face, and then it will help.
Good to know. Yes. Okay. Another question. Which injectables can visibly improve the elasticity of the skin on my face?
Okay, so once again, we're once again talking about products that will increase the collagen matrix, right? So once again, I would say if you have really, really dry, sensitive skin, my personal favorite is still Rejuran. I think Rejuran works really, really well for thickening the collagen matrix for skin hydration. If you have pretty good skin but you want maintenance, anti-aging, then I think Profhilo is great because Profhilo is convenient, easy, relatively painless, and also gives you that little lift, right? And then of course there are laser options to improve collagen in the skin as well. One interesting thing is that when you inject HA fillers, you are not really injecting in the skin, and you're not. Oh, that reminds me, there's also Volites. Volites is like a permanent moisturizer, you know, it's like a really, really good HA filler that you inject and it stays under the skin, it draws water to itself and it stays there for a year. So some people call it like the super skin booster because it stays there for such a long time. Basically, I see it as a permanent moisturizer. It's under your skin, it's keeping it moisturized for the whole time. So it's more like, yeah, so, okay, but these are treatments that are meant for the skin, right? There are also treatments, the fillers that it was not meant for skin, it was meant for lifting, it was meant for contouring. But you find that when you have fillers done over the face like this, right, the skin gets better also. And that's the collagen effect of the HA.
Yeah, sounds like a very, very convenient way especially for people like me, myself, possibly, who are a bit less disciplined with keeping up a good skincare regime, right? It's kinds of solves all things. Okay, so one last question. So I am from Indonesia. How do I make my skin youthful, anti-aging, shiny, and glowy?
In general,
Yeah.
good skincare habits, exercise, water, antioxidants in your diet, fruits, vegetables, sunblock. Sunblock is like super important. It's like unsexy, but super useful. Yeah. So skincare habits. In terms of lifting, skin tightening, always Altera first. Fillers to restore support. You want something like wow, then some fillers for contouring, some threads for contouring, wow factor. Skin quality treatments, pigmentation, once again, good skincare, sunblock, certain lasers, redness, eczema, sensitive skin, certain lasers. The Evertex has just reached Indonesia, and it's a wonderful, really, really wonderful laser. Ours is the first in Singapore, and it's pretty miraculous to me. So redness, and overall collagen. So stuff we talked about just now, Profhilo, Rejuran, Volite, and so on. But yeah, the most important thing is just don't go on Instagram and say, "Wow, this influencer is doing this," or like everybody seems to be doing that. I want to do this. Because if you do something that you don't need, then you're not really going to see improvements. You may get complications, downtime, and then you're going to wonder why you've done it at all, you see. And if you do things that may be nice in the short term, but not so great for you in the long term, that is also not a good thing to do. So how do you know, right? Ask a professional. Ask a aesthetic doctor that you trust, somebody who has treated your friend or family, you like the way the patient looks, and talk to your doctor, right, about your expectations. You must say, I want to come to this, I come to you today because this is troubling me, I want to do this, I want to improve this, and then listen to the options that's given to you by the doctor, right? And choose what's suitable for you, because there's really no need to like chase the popular treatments or the new treatments or the treatments that celebrity did or whatever. You need to do the treatments that's suitable for you. So yeah, consultation.
Nice. Okay, then I believe that's the end of all our questions. So thank you everyone for such an engaging session. There were actually more questions than expected. I myself have learned a lot more about medical aesthetics, like the perspective of actually lifting the support instead of filling things, and also maybe long-term hydration that can be injected into my skin for greater maintenance. Do stay connected with Dr. Felix via his Facebook and Instagram page at drfl clinic, or you can actually scan the QR code to WhatsApp the clinic directly to inquire more at the virtual background that he has. Or better, book a personalized consultation where he can assess your condition and give you a concrete treatment plan that will best suit your goals. All this information can actually be found on our post-event email as well, so do look out for it. And once again, if you'd like to arrange for an appointment with Dr. Felix Li to have your condition assessed, simply WhatsApp him at the contact number there, 9113-5212, and he will contact you shortly to arrange for one. So thank you for everyone for attending. It has been a great hour. Thank you very much, Dr. Felix.
Thank you
everyone who has participated so
Thanks
actively.
for the questions.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.